Welcome to a comprehensive overview of Hirschsprung's disease, a congenital condition affecting the large intestine. We'll explore the causes, effects, and management of this disorder that primarily impacts newborns and young children. Hirschsprung's disease arises during fetal development. Specifically, it's caused by a failure of nerve cells called ganglion cells to fully develop and migrate down the entire length of the colon. These nerve cells are critical for proper bowel function. The exact reason why this migration fails in some individuals isn't fully understood, but is believed to involve a complex interplay of genetic and environmental factors. Certain gene mutations have been identified that increase the risk, but the majority of cases do not have a clear, identifiable genetic cause. Now, let's delve into the underlying mechanisms. The absence of ganglion cells, a condition known as aganglionosis, disrupts the normal peristaltic movements of the colon. Peristalsis is the coordinated contraction and relaxation of muscles that propels stool through the digestive tract. Without these nerve cells, the affected portion of the colon remains constricted, creating a functional obstruction. This blockage prevents stool from passing through easily, leading to a buildup of stool proximal, or upstream, to the affected segment. This trapped stool can cause the colon to become significantly dilated, or widened, which can further impair its function and lead to complications. Hirschsprung's disease is relatively rare, affecting approximately 1 in 5,000 newborns. It's slightly more common in males than females. While it can occur in all ethnic groups, some studies suggest a higher prevalence in individuals of European descent. The disease typically presents in infancy or early childhood. Although there are genetic links, Hirschsprung's disease is usually not inherited in a simple Mendelian pattern. The signs and symptoms of Hirschsprung's disease can vary depending on the extent of the aganglionic segment. In newborns, common indicators include a failure to pass meconium, which is the first stool, within 48 hours after birth. Other symptoms in newborns and infants may include constipation, abdominal distension, vomiting, and reluctance to feed. Older children may experience chronic constipation, failure to thrive, and anemia. In some cases, a serious complication called enterocolitis, which involves inflammation and infection of the colon, can develop, leading to fever, diarrhea, and abdominal pain. Diagnosing Hirschsprung's disease typically involves a combination of clinical evaluation and diagnostic tests. A rectal biopsy is the gold standard for diagnosis. This procedure involves taking a small sample of tissue from the rectum to examine for the presence of ganglion cells. A barium enema, where barium contrast is introduced into the rectum, can also help visualize the narrowed segment of the colon. An rectal manometry, a test that measures the pressures in the rectum and anus, can also provide valuable information. These tests, combined with the patient's medical history and physical examination, help confirm the diagnosis. While Hirschsprung's disease is not typically categorized into specific types, the extent of the aganglionic segment can vary. In some cases, only a short segment of the rectum is affected, while in others, the aganglionosis may extend much further up the colon, even affecting the entire large intestine. The severity of the symptoms and the treatment approach can be influenced by the length of the affected segment. The primary treatment for Hirschsprung's disease is surgical. The aim of surgery is to remove the aganglionic segment of the colon and connect the healthy, normally innervated portion of the colon to the anus. This allows for normal bowel function. There are several surgical approaches, including the pull-through procedure, in which the normal colon is pulled down to the anus, and staged procedures, where a temporary ostomy, an opening in the abdomen for stool to exit, is created, followed by the definitive pull-through at a later time. Management also involves close monitoring for complications such as enterocolitis and ensuring adequate nutrition and bowel management post-operatively. Unfortunately, Hirschsprung's disease cannot be prevented. It's a congenital condition arising during fetal development, and there are no known measures to prevent its occurrence. Genetic counseling may be helpful for families with a history of Hirschsprung's disease, but the majority of cases occur sporadically with no clear family history. The prognosis for individuals with Hirschsprung's disease is generally good, especially with early diagnosis and appropriate surgical intervention. Most children can achieve normal bowel function after surgery. However, some individuals may experience long-term complications such as constipation, fecal incontinence, or enterocolitis. Continued monitoring and management by a pediatric gastroenterologist are essential. Recent research is focusing on understanding the genetic basis of Hirschsprung's disease and developing less invasive surgical techniques. Scientists are also investigating potential therapies to promote nerve cell regeneration in the affected colon. These advancements hold promise for further improving the outcomes and quality of life for individuals with Hirschsprung's disease.